Welcome to Behind the Clinic Doors, the place where we lift the lid on the weird, wonderful, funny, and downright inspiring world of foot health. By Lynne and Gareth, who are from Duet Diabetes. Thank you for joining me both. What gave you the idea to collaborate and form Duet Diabetes, and what's your mission?
Oh goodness, that's a big one. Duet Diabetes has been going for, oh goodness, over 10 years now. And right from the beginning, it was something that we were sort of passionate about in supporting people that in turn support others living with diabetes. And initially, it was kind of born out of the idea in East Anglia of supporting care homes in diabetes knowledge and support. And it kind of grew from a basic delivering and supporting them with just general diabetes awareness. And we soon realised that there was a greater need of more in-depth and more information.
Yeah,
You
why
know,
is why is there such a big need for training and confidence building around diabetes in care I suppose in care and in non-medical professionals as well?
well, I don't know what you think, Gareth, but I mean, one of the things I suppose is just the fact that the prevalence of diabetes is increasing just generally in the general population. And then if you sort of delve a bit deeper into that, when you're looking at people residing in care homes,
Yeah.
an older population, the statistics show, we're told that 1 in 4 people in care homes are living with diabetes.
Yeah.
So it's not, yeah, and it's increasing in the general population every year that
It is,
Diabetes
isn't it?
UK put their statistics out. The numbers, the numbers going up,
Yeah, it's not
and
going
within that,
down.
no, absolutely, absolutely.
That's very true. At the moment, around about 7% of the UK population is with diabetes. We've got about 4.6 million diagnosed. If
Yeah.
you look at Diabetes UK, they reckon there's another 1.3 undiagnosed. But if you include pre-diabetes, then we're up to about 6.3 million. So there's a lot of work to do. There's not enough podiatrists to go around. During COVID, a lot of the podiatrists were pushed onto high-risk feet and basically wound care, and there
Yeah.
still wasn't enough to go around. So
No.
we need more eyes on feet. It's as simple as that.
Yeah. Yeah,
Yeah,
definitely.
absolutely. And when I started Duet Diabetes, all those years ago, and we've now sort of progressed to deliver additional training, working with people, experts like Gareth in his field around foot care was a natural progression for us to be able to provide that proper in-depth knowledge. But again, to be able to adapt it to whoever was coming to our training and working with people like Gareth and some of our other colleagues who are just they're so knowledgeable about their their topic, their profession, but are able to communicate it in such a
Yeah.
sort of a helpful, friendly, safe environment. It really makes such a difference.
It does make such a difference. I've been on your training myself, and I've been on NHS training and some other private practitioner training. And yeah, I got so much from it. It's because you're very warm, welcoming, and you just build confidence. Although I knew quite a lot of the things that your topics that you were telling us, it just reinforced that. And I just think it's a good thing to continue just to go on the training if it's yearly, to go on it. That's what I think, because it just reinforces that knowledge and integrates that knowledge into you again. So I think it's good to do that.
Absolutely, because it's evolving all the time, isn't it,
Yeah.
Gareth? So, for example, last year, for our diabetic foot screening training, when Diabetes Africa published a brilliant new handbook about, diabetic foot care in different skin tones, although we were already highlighting it within our sessions, this gave us an additional tool, some other information that we could share that if come a year ago wouldn't
Yeah.
have had that kind of extra. So it's always evolving, and I just feel I feel strongly that actually people learn from each other as well. So
Yeah.
they come together in that room, different levels of experience, different levels of confidence, and yeah, Gareth's there as the expert, but within the room we have that other kind of the interactions that go on and that networking and supporting
Yeah.
each other, which is so, oh,
Get so much from that.
absolutely, and particularly the foot health practitioners, I have to say, are such an incredibly supportive bunch.
Yeah, we are.
Yeah,
Many of the
well,
listeners
we
are,
know.
sorry,
Sorry,
Gareth. Go on, sorry.
with foot health practitioners when we get together, they may never have met or they may be aware of one another, but by the end of the meeting, there's usually a WhatsApp group have been set up or they're swapping phone numbers. We had the same at the weekend. They'd drawn in, funny enough, into Shropshire from all over the place. But by the end of the day, they were being typical FHPs and swapping numbers, swapping cases.
It's about support, isn't it? Just supporting each
It
other.
is. Yeah, they're an exceptional group.
Yeah, definitely.
Absolutely. And when you talk about support as well, Gaynor, it's something that we again feel quite strongly about. It's something that we work quite hard at putting together. And as I'm sure lots of other training organisations do as well, is being able to signpost people to additional resources for that onward learning
Yeah,
beyond that day, but also
yeah, that's important.
what they can share, what you can share with your clients as well. Where can I get a really good booklet or a leaflet, or where can I suggest that? That's something that we try and spend. What we do, we spend quite a bit of time putting together. So that's a meaningful resource pack for you and your
Yeah.
clients.
Yeah, definitely, definitely. So many of the listeners are foot health practitioners. What are the key things that we should always keep in mind when treating someone with diabetes?
Oh gosh, it's just to be aware of the risk, really. I
Yeah,
mean, the vast majority of patients are low risk. There's no such thing as no risk.
yeah,
But the vast majority of diabetes patients are at low risk, but there's always that chance of something. So what they need to do is keep an eye on the patients, but also to arm that patient with enough information so that if something does crop up, they know they can reach out to the FHP or the local GP. It's just intervention early on will save so much trouble.
it will. It will. Why are feet particularly at risk for people living with diabetes?
Well, essentially, you've got the risk of blood supply problems, so people can end up with a higher risk of atherosclerosis, for example. So you end up with poorer blood supply down to the foot. And assuming that they're not very good at diabetes and they have persistent high levels of glucose in the blood,
Yeah,
if they do have that, then when I'm on the course, I talk about diabetes and how it works chemically within the body. But essentially, if you have persistently high blood glucose, then you can think of it as toxic to the body. So it'll give you problems with your small vessels, your small blood vessels, not only serving your feet, but also your kidneys and your eyes as well. And then it'll affect the nerve system as well. So you end up with neuropathy or nerve damage as well. And the nerve damage is probably
yeah,
the most sort of dangerous thing, if you like, in UK. That's the thing that causes most trouble. So in the UK and Western Europe, around about 25 to 40% of our diabetes population will, at some level, have some nerve damage. And in the profound cases, these patients can wound or injure their feet and not know about it. You know, they can stand on a drawing pin. They can, in one case, we have a case we discussed where a patient stands on a 3-pin plug, you know, and they do damage to the foot, but because they can't feel it,
no,
they don't inspect it. If anybody out there, when they're listening to this, if they hurt a part of the body, the first thing they do is they look at what they've done
look at
because
it.
it hurts.
Yeah,
The diabetes patient who suffers with neuropathy doesn't get that signal. So if they do step on a drawing pin, for example, they'll just carry on with that drawing pin in the foot. There'll be
yeah.
no obligation to look because they can't feel anything.
Gosh, yeah, you're right. What's some of the most common misconceptions you come across around diabetes and foot care?
I think with diabetes, the one thing that used to annoy me was, well, not annoy me, but irritate me slightly, was we used to get the type 2 patients in, and they used to say, well, I'm diabetic, but I'm not a proper diabetic because I don't have to take insulin.
Yeah.
And what the type 2s tend not to realize is that they are more at risk of developing foot problems than the type 1, particularly now, because with the type 1 diabetes, those are the patients who deliver insulin to themselves across the skin with injection. That's an autoimmune disorder. It usually comes after a viral infection, and it's usually in a primary school kid. exclusively. I mean, you can get 20, 30, 40-year-olds being diagnosed with type 1, but the type 1 is only about 8% of our diabetes population. They tend to have continuous glucose monitors now, which are connected to their smartphone. So they have a much greater and closer understanding of their diabetes. With type 2, it tends to be more of an insidious onset. It creeps up over the months or even years. So they tend to be the ones that come to us because they've already got symptoms
Yeah.
of poor diabetes control. So that's one of my thing where I'm not a serious diabetic because I don't use injection, but
Yeah.
they're actually more at risk
More
of
at
foot
risk.
problems
Yeah.
than the type ones.
Yeah, yeah. You're not being monitored the same. Well, they are being monitored, but I don't think they take it seriously enough. They're
No,
monitoring appointments, things like that, because they think I'm not on insulin. But yeah, the damage could be being done.
indeed.
How can beauty therapists, wellness practitioners, social workers play a role in spotting early warning signs with foot problems?
I will I'll I will let Lynn have a little go at this as well. But essentially, when I joined Duet a while back, there was already a course that Duet aimed at the beauty therapist, etc. And it's just making them aware. And even if at the end of the day's training we do, what we wanted to do is to prompt the patient, are you suffering with diabetes? And now I think it's becoming the norm when patients go into beauty treatment, whatever they're getting, be
Yes.
it nails or pedicures or whatever. Most therapists now will say, do you suffer with diabetes? So that was the number one aim, I think,
Yeah, yeah, and that does be,
I'm saying.
yeah, yeah, it's being said
And
a lot more.
she's worked more closely with the beauty industry than I have. I'll do a few talks, but it was Lynn's aim to really reach out to as many groups as possible. And originally she started with the care homes, but also the beauty industry as well. Now we're sort of stretching into primary care, some hospital care, as well as private practice as well. But over to you, Lynn, about the beauty therapists.
About the beauty industry, yeah. It was just us really thinking about who else sees feet, given that, the amount that the NHS, and it's not just about money, it's about quality of life, ultimately, and trying to avoid people having problems with their feet and ultimately amputations. And we do, in this country, we do spend more money on treating diabetic foot problems than we do with lung, breast, and prostate cancers combined. So that is a big amount of money. It's about 1% of the total NHS budget. And so, but like I said, just apart from the financial, you're thinking, think of these poor people that are having, ending up with foot ulcers, of which the vast majority are preventable. And that's the thing. I think that's the frustrating thing, is that the vast majority could be avoided. And so we were thinking, right, well, who else sees feet? Who else can help with that? And actually, it's the beauty and wellness
Yeah,
industry, reflexologists, nail techs, they're seeing feet all the time. And if they had a greater awareness and understanding, they're never going to diagnose, they're never going to treat like an FHP or a podiatrist or a healthcare professional. But if they've got that better understanding of what they're seeing, what's coming through the door, if something kind of concerns them, they can encourage their client to go and seek additional help from
yeah.
a healthcare professional, or if they've not been for their annual foot screening, and it's kind of trying, well, why not sort of, trying to
Have that
encourage that they,
conversation.
yeah,
Yeah,
absolutely. They can also really reinforce what you and other healthcare professionals encourage people with diabetes to do around daily foot care, because it's what they can do every day, day in, day out, really good habits
yeah.
that they can prevent, or at least reduce
Reduce, yeah.
hugely the likelihood of a problem. If they can help with those messages and good daily foot care, then hopefully some of those statistics
Come
will
down.
look better.
Yeah. That's the right word. Look
Yeah,
better.
yeah, yeah, yeah. So
Your Sorry, Lynn. Your work is about helping people feel confident. What does confidence look like in practice when supporting someone with diabetes?
oh goodness, what does that look like? What do you reckon,
Yeah,
Gareth?
it's actually very rewarding when you get a group of people in, and for example, with a lot of FHPs, they're aware that diabetes can cause problems, and they're very nervous about doing it. So hopefully, with the course we do, we start and we try and explain it in as simple a way as possible and in plain English. We don't use too much jargon. And if we do use something and it gets explained, so we try and put people at their ease in a position where they feel comfortable enough to answer questions. And most of the feedback we get, well, all the feedback we get is how relaxed people feel and able to ask questions. So by the end of the day, um, I mean, I enjoy speaking to people anyway, but the best thing is you can feel that swell within the room of people saying, right, now I know what to do. And you
Yeah.
give them that little bit of confidence. And most people, certainly with the FHPs, they just need a little bit of encouragement, to be honest, and a little bit more background, perhaps a little bit more knowledge. And the packs that Lynne produce are exceptional. It's not just me talking all day. They can go back to the whole slide collection. They can go back to the medical history side of things, and it just backs them up. And I think what it looks like is it means a more confident practitioner,
Yeah.
which is good from the patient's point of view, but it also good from the practitioner's point of view. You give them that confidence to go out. You give them reasons to ask. You tell them why they're asking the questions, why they're doing the tests, so they've got that depth of understanding behind what they're doing each day.
That's
And
I
I
think
find it great.
Go on. I think that's
Definitely.
really important because for referring on as well, giving us that depth and knowledge, and then it aims you with you're armed with the tools then to refer on as well, and you're not afraid to refer on either.
No.
So
Yeah, they have that confidence. Do you know what? I think it's that kind of age old, rather than just tell somebody, do this,
yeah,
do this, do that. They're more likely to do it and do it properly if they understand the why and the wherefore behind it. And this is where, like, Gareth does a great job of sort of building that knowledge, of getting the fundamentals and understanding, and you kind of build so people understand why they're doing this, why it's important to check feet, and then the palpating of the pulses and everything else. But it's that kind of journey, and creating that in people in a room. They've got the opportunity to practice, so
yeah,
confidence will come through that practice as well. And they get shoes and socks off. It's not just that theoretical. I think it's having that opportunity to do that, and as Gareth said, create that environment where they can ask questions.
yeah, it's
Nobody,
important.
it's a safe environment. No questions is, a silly question. So yeah, I think that all builds together with that confidence and like you said, when they then need to refer on or contact a GP or a podiatry department, they do have that confidence of what
Yeah,
they're talking about.
they do. They do. Do you have any simple tips or red flags you encourage people to look out for during your treatments or during everyday treatments?
Um, what we try and preach is for the patient to understand that there's potentially a problem there. So it's a little bit like when they cross the road, people automatically look left and right, hopefully. So when they get up in the morning, what we like them to do is check their feet out, or well, any time in the day. But the basic care for all patients, not just diabetes patients, but is just examine the feet, wash them, dry them carefully, especially between the toes, a little bit of moisturizer, fresh pair of socks each day, and tap the shoes out and make sure there's nothing going into them. And that's our mantra every single day.
Yeah.
It's nice and simple. Things to look out for: any changes, any color
Yeah.
change, any wounds, etc. If there's something coming out of the foot, be it bloody or pussy or whatever, then they need to get that addressed. But essentially, people need to get to know their feet, as it were. So
They do.
if
Yeah,
something does happen,
definitely.
they can spot it earlier. Early intervention is much better, as was everything else.
It
Yeah,
is.
and that's something that we strongly communicate around. When you mentioned before about the beauty industry, of then if they've got that better understanding, rather than having somebody in and they notice that there is actually, there's blisters, or there's actually a small wound on their foot or between their toes, they might, some might not realize, well, this is somebody with diabetes. Actually, perhaps I shouldn't be treating them without them first going and seeing a healthcare professional who can then sort that issue out, and then they can come back for their
For their treatment.
pedicure or
Yeah.
their reflexology session or what have you. But if they don't understand those basics, they might go ahead and treat, and it potentially make the issue worse. Or if that client didn't even know that they'd got a problem and it wasn't sort of discussed,
Yeah.
then, you know, in the course of a very short space of time, go from a little problem to a
Manifest.
bigger
Yeah,
problem. Yeah.
definitely. If a practitioner feels nervous about treating someone with diabetes, what's the first steps that they can take to build their confidence?
Um, I think it's important I mean, all of us will create our own networks once we qualify. So it's important to share problems. And obviously, I'm bound to say, well, if you're not confident, then come on a training course. For a couple of reasons, because we've got a structured course and it's easy to understand. There's a practical element as well. There's a socks off, hands on session. So if you're not too confident about pulses, for example, that was something that came up recently. Some of the practitioners are not very confident and they're not quite sure what to say to the patient when the patient says, "Well, what are you looking for my pulses for? I only came to have my nails cut." You know, so you give them that information about why it's important to find pulses to assess the vascular competency within the foot. So I think, yeah, I mean, training is always a good thing, and certainly
Good.
we found out, having carried out training through the awful COVID period, online is good, but there's nothing quite like getting your hands on a pair of feet,
No,
really.
it's not. No, no. I think in person's better. It's the connection with everybody else in the room as well, and you're sharing stories amongst each other as
Absolutely,
well.
yeah.
So
There's certainly when we get FHPs together, it's interesting because when we move into primary care, it can be quite quiet. But with FHPs, after the first break, we've usually got to
gassy.
interrupt a conversation to get started again. They're quite a chatty bunch of people, and I mean that in the nicest way as well.
I all love to talk. My clients know I love to talk. Could you share a story of an example where training or guidance made a real difference in someone's practice?
Um, yeah, the first one that springs to mind is always Jess from Milton Keynes, I think it was, Lynn.
Yeah, yeah, you're
Um,
exactly, that's the person
yeah,
I'm thinking
and
of if you want to tell the story.
yeah, I think she goes as Jess, not a pod.
Not a
Can't remember.
pod, that's right.
Yeah, contacting the NHS podiatry department and actually got an invite to go down to the clinic and spend some time with them, and she was absolutely blown away with that.
No,
And it
definitely.
was just reaching out. She has well, same as all foot health practitioners, you've got the patient's interests at heart. She knew how to
Massively.
express that. She could explain what she'd done, why she'd done it, and they just thought, right, this is somebody who knows what they're doing. Let's get them in.
Yeah,
So
yeah. And
it was
and
an
I
absolute result.
definitely with my local area, they arm you with what you need. So I could just refer straight into the podiatry department and CC the GPs in there. And I think that's brilliant because I remember when I first started out, they didn't accept it, so I'd have to go to the GPs. Sometimes the GPs would treat rather than referring straight onto the podiatry department where they should have been. So, it's just having that confidence, isn't it, to reach out, say like Jess had as well. So that makes a
Yeah,
massive
I think.
difference for your practice.
Yeah, I mean, historically, there's always been this slight barrier between foot health practitioners and NHS podiatrists, but
I don't think it's
that's
not
breaking down.
anymore. Yeah,
No,
it's
Yeah,
breaking
yeah,
down.
breaking down.
I think
Yeah,
they
and
are.
also, yeah, we had one FHP coming in on the course, and I had to smile to myself because she brought her podiatrist along. So she runs the practice, but she gets a podiatrist in to help with
There's a
mechanics or
few. There's a few
patient needs.
FHPs that do that. Yeah, yeah.
Yeah,
no,
yeah. So, and
definitely.
it's there for the best benefit of the patient. I mean, the podiatrists in the NHS, I mean, they are pretty stressed out. There's a lot of work to do, but they'd much rather
Stretched.
see a patient earlier in the process than having a massive wound to have to deal with.
Well, it's
Yeah,
months,
the
weeks,
frustration you
months, isn't
feel,
it?
yeah, it
With a
is. The
wound.
frustration you
So
feel when you get a wound is, I wish I could have talked to you before, or I wish you'd come 2 or 3 weeks before. Whereas now, if we get more eyes on feet, and certainly with our FHP colleagues, then it's better for the patient.
yeah,
Yeah, definitely. I mean, it's
definitely.
something we do encourage people, as I'm sure the providers do, but to make those connections and reach out to either local private podiatrists, their
Yeah.
GP practices, their NHS podiatry is at least they're being proactive in trying to make those connections. And then I think if they kind of demonstrate that they know what they're doing, and they're knowledgeable about diabetic foot screening and diabetic foot care, so that when they've got somebody in front of them that does need that referral, particularly if it's an urgent referral, that their fellow healthcare professionals will listen to that, because they know their stuff. So we do encourage, don't we, Gareth, that people go and make those connections. And we do increasingly hear some lovely stories, and yeah, it's very positive. And the upshot, the benefit is the people living with diabetes, they get the care that they need quickly and effectively.
Yeah, we do get follow-ups occasionally, and it, excuse me, it can be months after they've been on the course, but they'll get back in touch and said, "Oh, I've been doing what I learned on the course, and we referred a patient in, and I got a thank you from the NHS podiatrist or the GP." Or sometimes a patient will come back in, "Oh, I'm so glad you referred me because this happened, that happened." And occasionally in conferences, when we're there on the Duet stand, people come up and said, "Oh yeah, I referred this patient on," and the patients came back and is grateful.
Planning next year to sort of expand our foot related portfolio. So we've had quite a few people talk to us about Doppler use. And rather than just it be a kind of a quick short thing on tagging it on to the end of a diabetic foot screening, we're sort of realizing that actually allowing people time to have, either a half or a kind of a short full day where we can demystify Dopplers, would be that there's a lot of people interested in that. So that's something that we're watch this space. We're planning that we'll be running a workshop the day before the Yorkshire Foot Health Conference in Barnsley in March. So that's
what's the date for that, Lynn? The Yorkshire.
That is the 28th of March,
28th
I think. So so the day before will be, because the last couple of years we've always run a workshop the day before so that people can come and do a 2-day thing going on. And we're just with some feedback and thinking, well, we've done a lot of diabetic foot screening ones. This sort of demystifying Dopplers, will be available on that.
I think that would be really useful. I'm not without my Doppler. I check for the pulse, but also use the Doppler. And this, I've discovered so much with that. So and been had to refer on to GPs. So
also run ABPI assessment workshops. We know that not everybody feels that they want to be able to do that and offer that as a service, but we figured that if we do this Doppler, have this Doppler training as an option, and then at the end, Gareth can just talk through what that next step would be, like what is an ABPI assessment, the ankle brachial pressure index assessment. So it would give us the opportunity to sort of just demonstrate that at the end, so people have a better understanding. So if they're referring people on, they'll know that this is what's going to be happening. But then if they're thinking, I do really want to elevate my service and be able to offer this, or it could be, sometimes we'll have, podiatrists come to our training, other allied healthcare professionals that want a refresher. So yeah, that will be something as an option too.
Oh, that's brilliant. That's great. Where can listeners find out more about your services, or get involved as well?
Well, just our website really is the best place to start. So that's duetdiabetes.co.uk. So DUET. And then
I'll pop it on the end of the podcast as well.
So that's a good place to start, to have a little look about who we are and what we do. But always more than happy for emails, phone call. Keep an eye on our socials as well. I do try and put information on there about our open workshops, where people can just book on individually, because we do run sort of commissioned, tailored programs for bigger organizations as well. But we try really hard to do a certain number of open workshops throughout the year. So yeah, keep an eye on the socials as well.
Right, okay. Is there anything else you want to add to the podcast that we've missed out this evening?
I'm just trying to think. Not that I can, not that I can think of. Get your people living with diabetes to moisturize their feet every day. Do that
That's
every day.
important.
Check the 5 checks of, clean, dry, clean socks. Yeah. So check their shoes. That's another big one, isn't it,
Yeah.
Gareth? Tip their shoes out before they put their feet in them, in case there's something stuck in there. But yeah, just that everyday health,
Yeah. Just
foot health
checks.
is really important. But also, we're happy to have feedback and, like I said, this is why we're doing the Doppler training. It's we'll listen to people. If they come and say, could you do a bit more of this? We'll do our best to kind of meet people's needs, and the same where you are in the country. So towards the end of this year, we're up in Stockport, and then we're up in Teesside, so we're quite north at the end of the year. But we've been having some inquiries in the southwest and the southeast of England, so we're going to try next spring to be more in the south too.
Yeah.
So if people want to access this training, is get in touch with us.
Get in touch. Yeah, that's the best thing. Right. Thank you very much again, Lynn and Gareth, for joining me tonight. And thank you everyone for listening, and take care of yourselves. And most importantly, take care of your feet.